Hello everyone, myself Preeti Sharma from RKZIT Ghaziabad. Today I am going to deliver you a lecture on the topic, that is principle of prevention and control of Ebola virus and influenza. Ebola virus. First I will discuss here the Ebola virus and next we will come to the influenza. Ebola virus. Ebola, earlier termed as Ebola hemorrhagic fever, it is critically lethal ailment which primarily affects the humans and non-human primates. Ebola virus disease occurs due to a virus infection which belongs to the family Filvoridia and genus Ebola virus. We can say the Ebola virus is also known as the hemorrhagic. We are saying because it causes a bleeding inside and outside the body. We can say we are seeing the bleeding in this when we infect or any patient is infected with the Ebola virus, then there will be a bleeding in the body, and Ebola strikes mainly villages of West Africa, and it is a negative RNA virus which we can consider as a non-living entity, and this Restone Ebola was first discovered in laboratories of USA. And Ebola virus is an infectious disease which kills in a very short period of time, and we require a host to survive the Ebola virus. And the basic transmission of this Ebola virus is through the human to human and with the blood to blood, and with the personal we can say with the unsterilization. If the needle is unsterilized and the gloves is unsterilized, or reusing the gloves and the unsterilized gloves and the unsterilized needles in the hospitals, then there will be a mode of transmission. This is a mode of major mode of transmission we can say for the Ebola virus. And second is human to human contact. If a person come in contact with the human to human or blood to blood contact. Here the doctor, while investigating an alleged yellow fever case, this Dr. Peter Piotin in the year 1976 first detected the disease in Zaire, Africa. The main Ebola was termed as a disease and was noted near the Ebola river, that is in Congo. And Ebola virus transmission primarily takes through close bodily contact with the infected patients or their fluids, contaminated tissues, surface and clothing from alive, infected or individuals. Unsafe traditional burial practices, it play a pivotal role in the disease transmission. And some of the document evidence regarding this Ebola virus transmission. This is the document evidence which we have seen, that is sexual mode of disease transmission, and also the transmission through the air is very unlike. Now, as I told you in the previous slides here, that while investigating this yellow fever or the Ebola virus, this Dr. Peter Piot in the year 1976 first detected the disease in Africa, and Ebola virus is an infectious disease which kills a patient in a very short period of time. History. The Ebola virus first appeared in 1976, first in the Sweden, that is in Sudan, second is Democratic Republic of Congo, and third is 431. This figure recorded in the 1976. These are some history. For you have to remember the most important thing, that is Ebola virus is appeared in 1976. Now these are the sign and symptoms of Ebola virus. This Ebola virus sign is fever. Second is ache and pain, such as severe headache and muscle and joint pain, weakness and the fatigue, sore throat. Throat will become very sore throat. The patient is feeling the sore throat, and the loss of appetite is a sign of this, or we can say the symptoms of the Ebola virus. Gastrointestinal symptoms including, means there will be an upset of gastrointestinal tract or GIT. Upset of GIT means including the abdominal pain, diarrhea and vomiting. Unexplained hemorrhagic bleeding. Here this Ebola virus basically introduced into the human population with the, when they come in contact with the close contact with the infected animals. Means Ebola virus basically introduced into the human population when they come in contact with the infected animals. Here these are some symptoms of Ebola. Means you can see here headache, red eyes. Systematically it may produce the fever, loss of appetite, internal bleeding. These are the internal bleeding is the major symptoms of this Ebola virus. Now the next is muscular, or we can say the body ache, weakness, joint ache, intestine, in the intestine there will be an loss of water, or we can say the diarrhea, pharynx and lungs, hiccups, sore throat, difficult in breathing, difficult in swallowing, and the chest pain, stomach pain and vomiting, skin rashes and the bleeding. These are the symptoms of Ebola. Now these are the, what are the causes of Ebola virus? EVD means in humans this is caused by one of the 5 strain of the Ebola virus. These are the 5 strain of Ebola virus. Now, first one is Bundibugyo virus and Sudan virus, Typhus virus, Ebola virus and Reston virus. These are the 5 strains of Ebola virus. Now these are the diagnosis, how we can diagnose the Ebola virus. First one is antibody capture enzyme linked immunosorbate assay, or in the short we can say ELISA. Antibody capture enzyme linked immunosorbate assay, we are doing a ELISA test. If we are means antibody capture enzyme linked immunosorbate assay, antigen capture detection test, serum neutralization test, or RT-PCR assay if we are doing a reverse transcriptase polymerase chain reaction assay. And now the next is electron microscopy, virus isolation cell culture. These are some diagnosis, how we can diagnose the Ebola virus. Now these are the prevention and the control, how we can control and prevent the Ebola virus. First one is avoid the contact with the blood and body fluids such as urine, saliva, sweat, vomit, breast milk, amniotic fluid, semen, vaginal fluid of people and who are sick, and avoid the contact with the semen from a man who has recovered from Ebola virus until the testing shows that the virus is gone from his semen. And last one is avoid the contact with items that have come in contact with the infected person, blood or body fluids such as cloth, bedding and needles and the medical equipments. Means we can say here the personal items, we have to avoid the contact with the personal items that may come in contact with the infected person. So, we have to avoid that contact of such type of items, we have to avoid to come in contact with don't come in contact with that type of items which is already infected with the person, blood or with the body fluids. And here avoid the burial practices that involves the touching the body of someone who died from EVD or suspect EVD, that is Ebola virus, and avoid contact with the bats and forest antelopes and non-human primates, blood fluids or the raw meat prepared from these of the unknown animals. As I told you, avoid the contact. This Ebola virus introduced into the human populations through the when the human population come in close contact with these animals. So, avoid the contact with the animals because there will be a transmission of Ebola virus if you can come close contact with these animals like bat, forest, antelopes and non-human primates such as monkeys and chimpanzees. Now, here I will discuss now the prevention. Wash your hands as needed, means you have to wash your hand as needed, and isolate the patient. You have to isolate the Ebola virus infected patients, you have to quarantine that patient and wear a protective clothing, you have to wear a protective clothing and use the disposal or we can say the dispose of needles and syringes safely, dispose it in the proper place or safely we have to dispose the needles and the syringes which is using in the hospitals, and dispose of waste safely, you have to dispose the waste safely and dispose the needles and the syringes safely, wear always the protective clothes, isolate the patient, wash the hands as needed and use safe burial practices. You have to use the safe burial practices. Here, wash the hands as needed, isolate the patient. It is must and major we can say the point, that is isolate the patients, wear the protective clothing, you have to wear the protective clothes, you have to protect yourself, and dispose of needles and syringes safely. Here dispose of waste safely. And now the next is use safe burial practices, means you have to use it safely. Now, this Ebola virus, how we can prevent it from the spreading. These are some steps you can see here that avoid physical contact with people showing sign and symptoms such as continuous high fever, red eyes, vomiting and stomach ache. Here you can see avoid the physical contact with the people who is already infected with the Ebola virus. Here you can see these points. And now the next is that is wash your hand regularly with soap and the clean water. You have to wash your hand regularly with soap and clean water. Now the third one is do not shake hand with person showing sign of Ebola. If a person is infected with Ebola, then you have to avoid the shaking of hands from that person. So, it is do not shake your hands with the person. Now, the fourth is keep away from bats, monkeys, baboons and dead animals. Means you have to be away from the bats, means you have to be away from the animals, you have to avoid the contact with the animals. Now the last is avoid eating bush meat, cook all food very well, means uncooked meat should not be used. You should not use, avoid eating bush meat, and means you have to properly cook the meat and you have to eat that. Not uncooked meat should not be, should be avoided. Now some of the here mode of actions I will discuss, how the Ebola virus infects the, or we can say the Ebola is transfer into the body, whole body, means its physiology. I will here give a short brief on the this physiology. Now every tissues are affected. The most important thing is every tissue is affected except the muscles and the bones. Bones and muscles is not affected with this virus, that is Ebola virus, and it creates a blood clots, means Ebola virus creating a blood clots, and this clot goes towards the internal organs, means it will undergo the internal organs and it prevent the oxygen to reach the tissues. Means Ebola virus basically form a clots in the body, inside the body it will form a clot, and this clot will enter into the internal organs. They will affect the internal organ. This clot will move into the internal organ, and this internal organs, it will prevent the oxygen transfer, or we can say the oxygen reach to the tissues. Means we can say after formation of clot, this clot will move to the internal organs and it will prevent the reaches of oxygen into the tissues, and ultimately it will produce the this whole process which I have discussed here, that the patient is suffering from the virus. This is the main classification, or we can say here the Ebola. And now the next is influenza. Influenza means it is also known as the seasonal flu, or we can say the acute respiratory tract infection caused by the influenza virus. Characteristics by the sudden onset of fever and chill. Mode of transmission is person to person or droplet infection. Incubation period of influenza is 1 to 4 days. Flu, as I told you, flu is a respiratory infection caused by a virus. Influenza occur most often during the winter and easily spread from person to person. The flu season in the northern hemisphere runs from October to May and usually peaks between December to Feb, and most people who get influenza feel sick for a week or two and recover. In some people, the flu leads to more serious lung infection, or it may worsen the underlying conditions such as heart failure. These are the sudden onset of we can say the sudden onset of moderate to high fever. These are some symptoms: dry cough, headache, sore throat, chill, running nose, loss of appetite, muscle ache and tiredness. These are the symptoms of influenza. Now, we can come to the prevention of influenza, how we can prevent this influenza. First is the promotion, administration and easy access to the flu vaccine, that is live and the killed vaccine. Killed vaccine 0.5 ml for the adults in the killed vaccine and 0.25 ml for the children's. Route is subcutaneously we are giving and site of action is the deltoid region. And revaccination, every year we are giving the revaccination for the influenza. And here live vaccine, freeze dried live vaccine, and we can say the revaccination for the live vaccine is also done for every year, but intranasally by the route of administration for the live vaccine is the intranasal. And now the second is encourage the sick workers to stay at home, and hand hygiene and cough etiquettes means you have to cover your mouth while coughing and sneezing. This is use airborne infection isolation room when appropriate, ensure properly functioning heating, ventilation and air condition system, limit transport of infected patients, limit the number of staff who come in contact with the flu patients, and get yourself vaccinated against the current strain of influenza if possible. Keep your distance from people who show symptom of influenza like illness such as coughing and sneezing, and try to maintain a distance about 1 meter if possible, and clean your hands thoroughly with the soap and water, and clean them with the alcohol based hand rub on the regular basis, especially if touching surface that are potentially contaminated. Now, the next one is reduce the time spent in crowded settings if possible, improve airflow in your living space by opening the windows, practice good health habits like sleep, eating nutritious food and keeping physically active. Now, as I told you, vaccination means we are introducing a vaccine into the body to produce an immunity against a specific disease. In the 2009 pandemic, the initial demand for the vaccine greatly outspread the supply, and I told you about the killed vaccine and the live vaccine, by how we differentiate or how we can give with the help of different routes. Means killed vaccine is basically given with the subcutaneous route, and the live vaccine is here given with the help of we can say intranasal. You can prevent the flu, avoid the close contact, stay home. When you are sick, cover your mouth and the nose, clean your hands, avoid touching your eyes, nose, mouth, and practice other good health habits. Now, these are some references which I have taken from the reviews and research papers. So, thank you for your patience.